Understanding the concept of AIIMS, the All India Institutes of Medical Sciences, AIIMS, represent a unique and visionary concept in India's healthcare and medical education system. Unlike ordinary medical colleges or government hospitals, AIIMS institutions were conceptualized as centers of excellence where medical education, advanced research, and high-quality patient care coexist in a single integrated ecosystem. The idea was not merely to create another medical college, but to establish institutions that would define national benchmarks in teaching standards, clinical practices, research output, and ethical healthcare delivery. At its core, AIIMS is built on the philosophy that healthcare excellence cannot exist in isolation. A strong healthcare system requires well-trained doctors, continuous research, exposure to diverse clinical cases, and a strong public service orientation. AIIMS was therefore designed to function simultaneously as a teaching university, a research institution, and a tertiary care hospital, ensuring that learning is always grounded in real-world medical practice. Why India needed institutions like AIIMS in the years following independence? India faced enormous healthcare challenges. There was a severe shortage of highly trained medical professionals, limited access to advanced healthcare facilities, and an overdependence on foreign institutions for specialized medical treatment and training. Most medical colleges focused primarily on teaching, with limited emphasis on research or advanced clinical exposure. At the same time, government hospitals were often overburdened and lacked cutting-edge technology. AIIMS was conceived as a solution to these systemic gaps. The need was clear. India required self-sufficient, world-class medical institutions that could train doctors within the country, reduce medical tourism abroad, and serve as referral centers for complex and rare diseases. AIIMS was expected to act as a role model for other medical institutions, raising standards across the entire healthcare system. AIIMS as an institute of national importance, one of the defining characteristics of AIIMS, is its status as an institute of national importance. This designation is not symbolic. It carries deep academic, administrative, and social significance. It means that AIIMS institutions are established by an act of parliament, receive direct support from the central government, and are entrusted with responsibilities that go beyond state or regional boundaries. As institutions of national importance, AIIMS centers are expected to set academic and clinical benchmarks for medical education in India, lead medical research aligned with national health priorities, serve as top referral hospitals for complex medical cases, support policymaking and public health initiatives. This national mandate distinguishes AIIMS from other medical colleges and positions it as a backbone of India's healthcare ecosystem. Integration of education, research, and patient care. A defining feature of AIIMS is the integration of three critical pillars: education, research, and patient care. Medical students at AIIMS do not learn medicine only from textbooks. They learn by observing, diagnosing, and treating real patients under expert supervision. This integration ensures that theoretical knowledge is constantly validated and refined through clinical experience. Simultaneously, research conducted at AIIMS directly influences patient care. New treatment protocols, diagnostic techniques, and public health strategies often emerge from AIIMS research laboratories and clinical trials. This dynamic interaction between learning, discovery, and practice creates a continuously evolving academic environment that keeps AIIMS at the forefront of medical science. The social responsibility dimension of AIIMS was never intended to be an elite institution serving only a privileged few. A core principle behind its creation was social responsibility. AIIMS hospitals are known for providing affordable or highly subsidized healthcare, ensuring that even the poorest sections of society can access advanced medical treatment. This commitment reflects a broader philosophy. Healthcare is a public good, not merely a commercial service. AIIMS institutions therefore play a dual role, delivering cutting-edge medicine while upholding the values of equity, accessibility, and compassion. This balance between excellence and inclusivity is one of the strongest pillars of the AIIMS concept. AIIMS and nation building. From a broader perspective, AIIMS contributes directly to nation building. By producing highly skilled doctors, specialists, researchers, and healthcare leaders, AIIMS strengthens India's human capital. Many AIIMS alumni go on to become leaders in hospitals, universities, research organizations, and public health agencies both in India and globally. Moreover, AIIMS institutions often support national healthcare programs related to disease control, maternal and child health, nutrition, and epidemiology. Their expertise helps shape policies that impact millions of lives. In this sense, AIIMS is not just a medical institution, it is a strategic national asset. AIIMS as a model for the future of healthcare. The AIIMS model demonstrates how a healthcare institution can be academically rigorous, socially responsible, research-driven, and patient-centered at the same time. As India faces emerging challenges such as aging populations, lifestyle diseases, pandemics, and healthcare inequity, the AIIMS framework offers a scalable and sustainable model for the future. By continuously evolving with advancements in medical science and technology, AIIMS remains relevant across generations. Its emphasis on ethics, innovation, and service ensures that it does not merely respond to healthcare needs, but actively shapes the future of medicine in India. In conclusion, the introduction to AIIMS is not just an explanation of an institution, it is an introduction to a vision of healthcare excellence. AIIMS represents India's determination to build a healthcare system that is scientifically advanced, socially inclusive, and nationally impactful. Understanding the concept, need, and importance of AIIMS provides the foundation for appreciating its historical evolution, academic structure, research contributions, and role in public health, which we will explore in the next sections.